All right, welcome back. In case you're just joining us, it's still Moneyline with me, Nancy Najee. Joining us right now is Dr. Sam Ngwu, who was the former Commissioner for Health in Enugu State. Is joining us from Enugu. Welcome to you, Dr. Sam, and thanks for speaking with us today.
Good morning, Nancy. Thank you for having me on.
Thank you.
Apologies, we're having network issues.
Okay, Doctor, let's get started. And let's start with definitely that the resident doctors are on strike. I don't know where we are as of this moment that I'm speaking, but the last information is that they are still on strike while our president is abroad. As a former Commissioner of Health, what do you think of this kind of development in the country?
Number one, I think is insensitive on the part of the presidency, and then a big thing on the doctors and medical communities in this country for him not to have confidence in us to take care of him as our president. And secondly, on the resident strike, it is a shame. I'm not sure where this country is headed. There is no country that cares about life and health that will allow their doctors to go on strike during a pandemic.
Okay. How, in your own assessment, talk to me about what you think about Nigeria's health system, from the infrastructure to welfare of staff to everything concerning our healthcare. What's your own assessment of it?
Our healthcare structure here is basically collapsed here in Nigeria. I trained overseas, and this pandemic exposes the weakness of our healthcare structure. There is basically no infrastructure, no equipment, even medical commodities. This pandemic just shows that we can't even take care of our own. You know, people are dying for lack of oxygen, and nobody cares.
Doctor, just give me the difference, because I know that you were trained in America precisely, and you practiced there. Talk to me about the difference between the American health system and this place. I do also know that the American health system is under so much pressure right now because of COVID. But are there some differences, or what are the differences between the healthcare system there and ours?
There is like that. It's a total. There is really no comparison between Nigeria. There's no healthcare system here. There is no comparison whatsoever. American healthcare system is structured. And it is in America, their president supposed to take care of, to get medical care overseas. The chairman of the Nigerian Medical Association will resign. Look at in Russia when President Yeltsin wanted to go and have a heart surgery in America. The medical community, the president of the Russian Federation Medical Association, and all the doctors threatened to resign if they took care of it. He eventually had that surgery in Russia by Russian doctors, and it was successful.
So what is the missing link there? Because you talked about American health system being structured. What kind of structures should we build here in Nigeria?
You know, with the nobody cares here, everything is being politicized. You know, the doctors are, posturing with their position. The doctor, we are privileged profession. We are humanitarian work. This is God's work. And once you mix politics with the practice of medicine, it doesn't get you anywhere. People's care gets compromised. And that's what is happening here. In America, the doctors are practicing medicine. The professors are doing their research. But here, everything is about politics. And it's a shame.
If we take a look at the way that healthcare, the way healthcare is being managed in the US, for example, and here, if we take a look at the teaching hospitals, or we take a look at tertiary medical institutions, you see that the chief medical director is a doctor. Do you think that model is okay? Because hospitals also are business concerns. So should a medical doctor, for example, be heading a medical facility? Should we get managers, private sector people to manage the hospitals while the doctors face the work of getting patients better? I hope you understand what I mean.
Yeah, I understand what you're asking.
Will that model be better? Will that model be better here than, like, you were former commissioner of health? I guess the chief medical director of Enugu State Teaching Hospital so would be a medical doctor. If we switch to this kind of model, because hospitals are also business concerns, and if we take a look at it from that angle, vis-a-vis that there is also God's work, will it work?
Well, only and everywhere in the world, it's doctors that manage the hospital. So the CMD should be a medical doctor.
Okay.
And being a medical doctor understands how to run a hospital, the logistics of a hospital, the clinical correlation, the procurement of the equipment and medical commodities. Only doctors have the expertise to do that.
Can doctors be excellent business managers in that sense?
Yes. I'm a medical doctor and also a businessman. I own a hospital here in Enugu Medical Center. I procure things, I manage everything. And where is it?
Go ahead, doctor. Doctor, can you go ahead? Can you hear me?
Yeah, I can hear you. Only doctors can best manage medical facilities. But here in Nigeria, they're trying to play politics with it. But everywhere in the world, it's the doctors that manage the hospital.
If we take a look at the World Health Day that was just commemorated, I think about 2 days ago, the theme is building a fairer and a healthier world. How do you think that we can build a healthier Nigeria, especially with COVID right now? The vaccines are in the country. Some are still showing apathy to the vaccines. They don't want to take it. How do you think that we can build a healthier nation with this kind of, or with a newer healthcare system?
I think we need to take politics out of the Nigerian healthcare system, number one. And what we're doing here is practicing social medicine, socialized medicine. I think, every stage or region should be allowed to develop their healthcare structure based on their needs. Not the presidency coming up with a program. They can call it Save 1 Billion Life or whatever they want to call it. And then they give every state equal amount of money with a blueprint on what to do. That's not how medicine, that's not how healthcare structure should be developed. Every state should have its expertise. Like if you come to Dallas, medical city of Dallas are the best in the world in supporting for joint twins. If you go to Johns Hopkins, if you go to Baylor University Hospital, so we allow each region or state to develop their health structures based on their needs. Then the health structures what occupy other countries. Even Ghana, their lifetime expectancy is much higher than Nigeria. They're copying the white man's way of doing things. But here we're doing politics with everything, and that's not going to work. And when government controls 98% of the health industry, check other countries where the health structure is optimal. The government controls about 8 to 5%. Until that is resolved, our ability to check our people, they will not change. We will continue to have a lot of medical services.
Since you're talking about states should take control of their health needs, states are in charge of the primary health care, isn't it? How far have the states gone with primary health care? Doctor, I'm getting an interference from your end. I don't know what that is. Hello, doctor, can you hear me? Hello, doctor, can you hear me?
I'm not hearing you.
Okay, can you hear me now?
Yeah, I can tell you now.
Okay, I actually asked earlier that how far have the states gone with even primary health care, with your own arguments that they should be in charge of their own health. How far have they gone with their primary health care? When you go over to states, you see the primary health care centers in very dilapidated states. So how do you think that states will be able to run full healthcare system when they've not been able to fulfill the needs of primary health care?
Well, the problem with Nigeria is we copy America. I was a resident doctor in America when they started primary health care under one roof. We just copied it in principle, but we don't know how to practice it in practice, to affect patient change. All this money is being dumped in it without any result. So until we have compassion for the sick, a different way of taking care of our people, nothing is going to change. I was listening to the director of primary health care, national director. He was talking about it on TV. As an expert in this field, he was just talking about a section of it, maternal and child health. That's just a minute section of primary health care.
If we take a look at the medical tourism so far, I may not be surprised, for example, Doctor, can you hear me?
I can hear you.
Okay, I may not be surprised so far that President Buhari is out of Nigeria. He's in the UK for medical checkup. I may not be surprised there is a Nigerian doctor that will be attending to him in the UK. Because you see a lot of Nigerian doctors, a lot of Nigerian healthcare experts leave the country, go to other countries around the world, and they excel, they do well over there. As a Nigerian, when you leave this place, you go overseas for checkup or whatever, you may be surprised that the person that will attend to you will be a Nigerian when the person comes through the room. So what do we do to encourage doctors, to encourage healthcare workers to still stay put in the country?
I agree with you. Infrastructural development, not joking. Government has no interest in entrepreneurship of private hospitals or private individuals. Something has to be done about that. Just like Dangote is being supported with the Nigerian money to develop his industry. The healthcare industry, something should be done if we need to move our healthcare structure to the next level. And I agree with you. When I was overseas, I came home from Southwestern Medical Center in Dallas. When some of these leaders come, I'm part of the team that treated them. So there is no place you will go that you won't see Nigerians in the medical profession. And we are very good. Like myself, I'm an internal medicine consultant. I don't think Buhari will find anybody better than me in this world to take care of him. And going over there is very insensitive, and they disdain on the medical community here in Nigeria. And I think the Nigerian Medical Association chairman, national, state, and his executive, they should protest by either resigning so that we can take politics out of caring for people.
If we take a look at the doctor-to-patient ratio in the country, it is very high because you're seeing an exodus of doctors or healthcare professionals out of the country, and that is making the doctor-to-patient density higher here in the country. I think a doctor-to-patient ratio could be 1 to 10,000 or so. The last data that I checked is been a few months now. I don't know what it is right now. How do we begin to encourage even new doctors to come on board? Because we have tertiary institutions, medical schools all across the country, so that they don't also leave.
Yeah, we have to develop our healthcare infrastructure. We need to pay the healthcare workers better. I own a private hospital here in Enugu. About 2 of my doctors have left to Scotland, medical officers. So it's terrible that we are training our doctors for other countries to take them to work for them. The doctors need to be paid better. The healthcare workers need to be paid better. Overseas, if you, even a medical student, government gives you a single digit to purchase a vehicle, but the doctor here is practicing for 5 years and still driving tickets. That's horrible. Medical doctor is a privileged profession, and it's not meant for everybody. And they should be compensated better. And that's why overseas they don't play with their doctors. That's why they attract our doctors from here. The exodus is enormous. And until something is done to pay them better, to take care of them better, we will continue to lose them.
Doctor, how do you think that we fared as a healthcare system fighting COVID-19 in Nigeria, as against the predictions by different bodies that, oh, dead bodies will be on the streets of Africa during COVID, that we may not be able to fight it well? Take a look at, analyze Nigeria's response health-wise to fighting COVID-19 in the last 1 year or so.
Nigerian response to COVID-19 is basically comatose. The NCDC, they're just throwing numbers every day. Numbers of, on the 7th, they come up with numbers of 110 new cases. And then a total number of 163,444 total infected in Nigeria. That's insignificant data. It does not make sense. They need to tell us percent ratio. They need to give us data that has confidence level, not how many people were tested, so that we can see what is the infection rate. And based on that, we can calculate 180 million or 200 million Nigerians and see how many people are at risk. How prepared is the country to take care of our own? About 60% of the people that get infected, 40 will be passive infection and mild symptoms. But about 60 to 40% will be severe symptoms. And of that 60 to 40%, 50% of them will need oxygen. The other 60% will need mechanical ventilation. How many functional mechanical ventilators do we have in Nigeria? That's what we need to hear from the Presidential Committee on COVID-19, not just politicking and coming up with numbers that doesn't make sense.
So are you saying that we've not even done well fighting? Okay, you talked about government. How about the people? Do you think as a people that we fared well in battling COVID-19? Since we have a population of 206 million people, how many of us have contracted the virus? I know a lot of us also lost loved ones, still losing loved ones. But how do you think that we fared as a people combating the deadly virus?
The problem is the government has a role in creating awareness, public health education. Here in Nigeria, people just have fear instead of facts. And if they have facts, they will know what to do. How many people will can get tested? Testing is not free. It's about 10,500. How many Nigerians can afford it? Governments everywhere else, including Ghana here, are testing their population free. You know, and why is that not done? How are they coming up with all these numbers they're releasing every day? 110 new cases. How many people did you test to get that 110? So that we can get the percent ratio of infectivity.
How do, especially with the advent of technology now, Doctor, how do you think that we can leverage technology to improve the health sector? We've seen the advancement around telemedicine and what have you. How do you think that we can leverage technology to develop the health sector?
Government interest in the healthcare industry and in the healthcare community, and not just government. We have a lot of UNIAs here. They should invest in the health structure. They should remember that in the case of emergency, they cannot get to overseas in 1 hour. You know, it's going to take at least 6 hours to get them overseas. And 1 hour in a medical emergency is very, very significant. So I encourage our entrepreneurs, I encourage our industrialists, I encourage our politicians, our big men, the Dangotes, to invest in the healthcare structure.
If we take a look at financing the healthcare system, this year's budget rather, 2021, the federal government earmarked about 632 billion naira or so to the healthcare system in Nigeria, including Gavi and some other things in that budget. How much do you think that we should be able to make available to the healthcare system in Nigeria? Because we're still not there yet. Healthcare sector funding to GDP is still less than 5%. Hello, doctor.
Are you hearing me?
Yes, I can hear you now. Did you hear my question?
I have your question. You said how much do I think could be invested in the healthcare structure?
Yes, because our healthcare sector funding to GDP is still very low. It's less than 5%. In fact, on the screen there is about 3.8%. So, what can we do to finance our healthcare system, or what kind of model right now should we take to finance our healthcare system? Because a lot of Nigerians do not even have healthcare insurance, which is another issue.
Well, the World Health Organization wants our country and most other countries to devote at least 5% of their budget to health and caring of their people. So I agree with that. Nigeria government has approved that, but the money is not there to fund it. And secondly, would agree with the American model, which is aggressive, not British healthcare model, which is very conservative. And infrastructural development, equipment, training. You know, our healthcare people here are poorly trained. You know, a lot has to be invested in training them. And we need to remove politics out of the healthcare industry.
If you're talking about training, where should that training come from? Because most of our healthcare professionals pass through medical schools and professional schools where they pass through, whether radiology or what have you. Are you talking about coming out of school and they get trained again, or they should be well trained in the school? Because a lot of people have also said that when you see healthcare workers, nurses, doctors, some are not well trained. They don't talk to their patients very well. They don't come to work on time. A doctor on call may not be there, and the patient dies. A lot of Nigerians have also, said that some of the deaths they've experienced in their families is due to doctors' negligence, the system negligence. How do you think we should attend to that?
Well, we should address that by the fund.
Doctor, okay. I guess the network. Okay, we've lost Dr. Sam Ngwu there. I've been speaking with Dr. Sam Ngwu, who was the former Commissioner for Health of Enugu State. Thank you for watching our video. Please hit the subscribe button below, turn on post notification to follow all our updates.